Hello, I am Dr. Jaydeep from the Ashwini Maternity and Surgical Hospital, Mumbai, India. The treatment of male infertility, again depending on the cause, is usually divided into medical treatment, surgical treatment if there is a surgical cause of male infertility, and then finally, and I must say in the large majority of cases, in vitro fertilization and intracytoplasmic sperm injection, more popularly known as IVF or ICSI. In a sense, IVF consists of us retrieving the eggs from the woman's ovaries and then using intracytoplasmic sperm injection with a special machine which is known as a micromanipulator to inject one sperm directly inside one egg. Theoretically, this means that, for example, if I retrieve 10 eggs, all I need are 10 sperm. You can therefore understand that this huge technological advance has made sure that there are extremely few males who now need to resort to donor insemination. Speaking a little bit about the IVF-ICSI process, the process is essentially divided into 3 or 4 sections. We start first by evaluating the male and the female partner, and if it is determined that they need IVF-ICSI, then we need to first grow the eggs in the woman. Typically, the IVF process commences with a series of injections which the woman needs to take for 10 to 14 days. As she's taking the injections to make sure that her eggs grow, we need to monitor the process to make sure her eggs are growing. This is usually done by performing a transvaginal ultrasound, perhaps 2 or 3 times in the entire cycle. Once we ascertain that the response to the injections is adequate and the eggs have reached the adequate size, a final injection known as the trigger injection is given. 34 to 36 hours after the trigger injection is given, the woman is admitted to the hospital. Typically, a general anesthetic is administered, and by the use of a transvaginal probe and a special needle called as the oocyte pickup needle, the woman then undergoes an egg recovery, also otherwise known as an oocyte pickup. Once these eggs are obtained, the eggs are then transferred to the in vitro fertilization or the IVF laboratory. In the IVF laboratory, the eggs are denuded and it is determined how many of the eggs which are recovered are mature. Typically speaking, around 70 to 80% of the eggs that are recovered tend to be mature, or what are called M2 oocytes. These M2 oocytes are then subjected to intracytoplasmic sperm injection. This is an extremely fascinating process which literally happens at the micron level under a very powerful microscope and an instrument called the micromanipulator. So on one end you have a holding pipette which holds the egg. On the other hand, you have an injection pipette which is used to inject the sperm. But the sperm is a motile organism. So before we actually inject the sperm into the egg using the injection pipette, we need to first make the sperm immotile. And this is done by beating the tail of the sperm on the petri dish, making it immotile, then sucking it into the injection pipette, and then puncturing the egg and then leaving the sperm inside the egg. This process is of course called fertilization, and the result of this fertilization is then seen on the next day. Depending on when your doctor has advised you to undergo the transfer, the embryo transfer can be done 2 days, 3 days or 5 days after this fertilization process. The embryo transfer procedure happens in the operation theatre, and for this to happen, the embryos are taken in a plastic cannula which is known as an embryo transfer catheter. This catheter is loaded with the embryos and then inserted through the vagina into the uterus of the woman, where the embryos are left behind. Now this is the point at which nature takes over. There is a process which has to happen now which is known as implantation. In very simple terms, implantation is the reaction which should occur between the embryo which has been implanted and the lining of the uterus of the woman known as endometrium. It is because of this that the outcome of any IVF procedure does not exceed around 35 to 40%. Typically, patients sometimes feel that 35 to 40% after putting a ready-made pregnancy could be considered to be very low, but this is far from the truth. A 40% chance is actually several times more chance than that patient would get even if she were to be completely normal. Once the embryos are transferred, the patients are put on some medication to support both the lining and the embryo, and 14 days later we do a blood test called serum beta HCG to know whether that patient has conceived or not. For any patient who's trying to get pregnant and is finding difficulty to get pregnant, I would just like to say this one thing: don't stop trying. Technology is now at a stage where there will not be any couple who cannot have their own child. The important thing is, if you don't stop and don't give up, you will get a baby.